Hi there and welcome. Today I want to have a really honest and gentle chat about something that affects so many of us, but we often don't talk about it out loud. We're going to talk about how to reclaim comfort and confidence in our own bodies. It sounds so simple, doesn't it? But for so many women, especially as we move through perimenopause and beyond, it doesn't always feel that way. So if you're one of the many women who's been quietly dealing with discomfort or even pain, I really want you to know you are so far from alone. And there is a gentle path back to feeling like yourself again. So let's dive right in by asking a question that might sound, well, pretty familiar to some of you. As our bodies change, it's totally normal for our experiences with intimacy to change too. Does this sound familiar? That feeling of dryness, friction, or maybe a burning or soreness that kind of lingers after you've been intimate. It actually has a clinical name, but really all it means is that something that should feel good just doesn't anymore. And it is incredibly common. And when I say common, I mean it. Look at this number. We're talking about 50 to 70% of postmenopausal women experiencing these exact symptoms. That's a huge number of us. So if this is hitting home for you, please hear this. It is not just you. It's not a personal failing, it's biology. Okay, so what is actually going on in our bodies to cause this shift? I think understanding the why is so empowering, right? It's that first step to feeling back in control. So let's gently unpack the science behind it. So there's a medical term for this collection of symptoms. It's called genital urinary syndrome of menopause, or GSM. I know, it sounds super intimidating, doesn't it? But all it really is a name for the changes that happen when our estrogen levels naturally dip. It's a completely normal part of our life journey, not a disease to be afraid of. This really helps to see what's going on. Think of it like this. When we have plenty of estrogen, our vaginal tissue is, well, it's plump and stretchy and naturally lubricated. But when those estrogen levels drop, that same tissue can get thinner, a lot drier, and way more fragile. You can just imagine how that would lead to friction and discomfort, right? It makes perfect sense. But here is the really, really good news. We absolutely do not have to just put up with this. There's an incredibly effective, safe, and gentle way to restore our tissues' health and bring back that feeling of comfort. And that solution, the one that's considered the absolute gold standard by groups like NICE and the British Menopause Society, is local estrogen. And the key word here is local. This isn't the same as the systemic HRT that goes all through your body. This stuff works right where you need it to, and pretty much nowhere else. I just love this quote because it hits the nail on the head. It says, vaginal estrogen doesn't just wet the tissue, it rebuilds it. This is so important. We're not talking about a temporary fix, like a Band-Aid. We're talking about actually healing and restoring the health of the tissue from the inside out. So how does it do that? How does it actually rebuild things? Well, it's pretty amazing. First, it gets to work restoring the tissue's thickness, making it more resilient again. Then, that in turn helps improve elasticity, bringing back that comfortable stretch. Third, it wakes up the glands that create your own natural lubrication. And finally, it helps restore that protective acidic pH, which is like your body's natural defense system against infections. Okay, let's tackle the big one. The question I know is on so many women's minds, the cancer risk. It is so important to get this clear. Local vaginal estrogen is a completely different ballgame from systemic HRT. The dose is super low and almost none of it gets absorbed into your system. For that reason, it's considered safe for the vast majority of women. And what about just using lubricant? I mean, that helps, right? And yes, absolutely. Lubricants are fantastic for reducing friction in the moment, but think of them as a temporary helper. They don't fix the underlying problem of the tissue's health. Local estrogen, on the other hand, treats the root cause. Of course, the best plan? Use both. Why not have maximum comfort? Okay, so figuring all this out on your own can feel like a lot, and that's why having a guide, a real expert you can trust, makes all the difference in the world. And this is where I want to introduce you to Dr. Farzana Khan from the Women's Health Clinic. Her entire approach is right here in this quote. It's about clear explanations, setting realistic expectations, and making decisions with you, not for you. It's all about being a team on your health journey. And her expertise is just so deeply reassuring. We're talking about someone with over 2 decades of experience, a special diploma in sexual and reproductive health,
And get this, she actually trains other doctors all over the world in this very field. So you know you're in the hands of someone who is truly at the top of her game when it comes to compassionate care for women's intimate health.
So now that we understand what's going on and who can help, let's talk about the practical side of things. What are the actual steps you can take to move forward and start reclaiming that comfort with confidence?
Well, the great thing is you have options. Local estrogen isn't a one-size-fits-all thing. It comes in a few different forms, so you can pick what feels right for your lifestyle. There are creams, which give you flexible dosing. There are pessaries, which are just tiny little tablets that are super easy and discreet, and even a soft ring that you pop in and can forget about for 3 months. How convenient is that? And while your treatment is working its magic, there are a few simple things you can do that can make a huge difference. Using a good water-based lubricant, keeping up with gentle activity to keep tissues healthy, avoiding those harsh scented soaps, and sometimes seeing a pelvic floor physiotherapist can be a real game changer for any muscle tightness.
Okay, here's a fantastic little pro tip. This is especially for any of you who also deal with bladder urgency, which is super common. When you're applying the cream or pessary, try to aim it towards the front vaginal wall, the one closest to your belly button. This helps get the treatment right up against the tissue that supports your bladder and urethra. It's a small tweak that can have a big impact.
And finally, let's talk about being your own best health advocate, because it's so important to know your body. While local estrogen is incredibly safe, you should always check in with your doctor if you notice any of these red flag symptoms. Things like unexpected bleeding, pain that doesn't go away, or any new lumps or sores. This isn't about being scared, it's about being smart and in charge of your health.
So the big question is, are you ready? Ready to rediscover what comfort and confidence feel like again? Please hear me when I say that discomfort does not have to be your new normal. With the right information and the right support from incredible experts like Dr. Farzana Khan and her team, you can get to the root of the issue, restore your body's health, and reclaim the joyful, comfortable intimacy that you absolutely deserve. This is about so much more than just managing symptoms. It's about feeling like you again.